Uh, Welcome back to MMHC. So very nice to have you guys here. We got an awesome episode for you today, like we do every single time.
Every time.
Every single time. We got a shout out for you. Who's our shout out, Eddie?
Well, shout out to Uncle Calvin, huge fan of the show. He texted us with the show idea, and we told him we'd do it. We're here. I'll tell you what it is in a little bit, but I wanted to give him a shout out. And then I also wanted to give a shout out to Amy for a super dope card that she made me after the piñata incident that I shared in one of our recent episodes. That was super cool. She sent me a handmade card to make me feel better for some traumatic experience I had when I was in elementary school. But the timing is actually really perfect with Uncle Calvin texting us about hypochondria. Oh, I gave it away. Because literally like 3-4 days ago, Kevy told me the other night that she's like, you probably don't have hypochondria, but you act like it sometimes. And I was like, well, since the symptoms don't impact my daily functioning, I probably wouldn't meet criteria. And she's like, she said something to the effect of like, well, sometimes it seems close, which fair enough. Sometimes I overly just think things like I don't know, man. You know what? It happens too when I get stressed. And when I get stressed, I will like, I don't know, I'll feel on edge. And I've probably had like higher cortisol levels for an extended period of time. And I'm not paying attention to it. And I don't know, I'll get like a random like, you know, when you like catch a cramp in your side, when like, you know, not even working out, but you just like catch a cramp, or I'll feel like a random pain here or like a dull thing. Like, and I'm just like, fuck, what's wrong with me? So I think that's where it comes from a lot. I think oftentimes, if I really look back at it, it's related to stress. And then when I can talk about it, I feel a lot better. But I just keep it to myself, and then I don't feel better.
Yeah. Before we go on, give me a quick tap on your mic. I want to make sure that we're... Okay, good, cool. And
Yep.
groovy.
We sounded okay?
Yes, I just wanted to make sure we're... Because I was like,
man.
oh, we've made this mistake in the past and
We've
switching
been
to Riverside.
fucked before. Oh.
And what you say brings up a really good point, where a lot of times anxiety comes out in our body. And I know we've talked about the book, The Body Keeps the Score, in the past, but some people are more prone to somatic symptoms, so feeling the symptoms of anxiety in your body. It's more common in children, but even some adults and even people with like borderline personality disorder are more likely to have physical complaints of their anxiety too. So it's a real thing, and the more anxious you are, the more likely you are to think that something's wrong with you and feel these things in your body.
Yeah. Especially if it just like doesn't go away. I think that's where it gets me, and then I just start this cycle of like, oh shit, something is wrong. Like something is wrong with me. I'm gonna die. WebMD says I'm gonna die, and I just like I get worried and I get stressed. I think of like, I don't know, before I got my wisdom teeth out, which I did as an adult, right? Which is like a weird thing apparently, but like there'd be times before I got them out, because right when I did finally get them out, like a month before I got them out, like I did have some like, I should probably get them out now. But before it would just be like, oh, I felt something twinge, like something's wrong, and then I would like tell Kevin, and she's like, when does that happen? I'd be like, when I do this. Okay, don't do that anymore. Like, oh shit, yeah, probably. Like that's a good point. But yeah, I think I am just an anxious person to begin with. And that's what makes it worse. Which, interesting enough, I'll talk about it a little bit. Why? I'll wait. I'll get to it in a little bit. We'll save it.
And I know you mentioned shout out to Uncle Calvin, who gave us the idea for this episode. He's been one of our biggest supporters. I think he's listened to every single episode. He's also my father-in-law. Just like, thank you so much for being such a huge supporter.
Absolutely.
We appreciate him so much. We appreciate you, Calvin.
Just like Dana and Kevy have been rocking with us when we had questionable sound quality, Uncle Calvin's been there too. So
yeah, rode the wave with us.
That's right.
All right, Eddie, what illnesses are you most worried about?
Fuck, man. I don't know. Why did you...
I just added this to the show notes too.
I saw it when I logged on. I was like, there's the Google Doc line that you just put this in. You know, when COVID was going on, I would sit in my office and take deep breaths and try to hear if like anything sounded off with my breathing, of like Is this sounding okay? That concerned me a lot, especially in the beginning. Still does. I mean, it's still out there. I think anything, I don't know, like anything like head related. Like if you get a headache, I hate getting headaches. I try to stay hydrated. I just anything, man. It could just worry me. Now you got me going.
That's mine too. Like anytime I get a headache, like, and I know a lot of medical students do this. I'm like, little twinge of a headache, and I'm like, could be a brain tumor. Why do I do this every time?
The one that gets me too is my chest. Like if we work out and then 2 days later I'm still like sore in a random spot. You know, there was one time I was working out and I was using like those curled bars for like curls and the curled barbell. And I went to put it back and it like I didn't put it on properly, so it started to fall off the little holder and I caught it. But the way I caught it, like really, it was like my chest felt really off after. Like I think I just like pulled a muscle. But it was still there for a while, and I kind of forgot why it started, and then I'd feel like the semi-chest pain. I'm like, oh, fuck, like, this is it. I'm done. Like, I don't... Why am I having chest pain? Like, what's happening? So that's where my mind goes. It's fucked up.
Yeah, every time.
Yeah.
So, we'll give you a definition. What is hypochondria or hypochondriasis? Interestingly, hypochondria used to be in the DSM, like the actual term hypochondria, and most recently in the DSM-4. It was defined as a mental disorder characterized by preoccupation or fears of having a serious disease based on misinterpretation of bodily symptoms in the DSM-4-TR.
Approximately 75% of individuals previously diagnosed with hypochondria, are subsumed. I had to look this up, or absorbed under the new diagnosis of somatic symptom disorder in the DSM-5. So basically, 3/4 of the people that used to meet criteria for hypochondria more meet the criteria for somatic symptom disorder. The remaining 25%, have high health anxiety in the absence of somatic symptoms, and they more fall into the illness anxiety disorder diagnosis. So 2 different diagnoses. One is more the anxious part, the like mental emotional part, and the other one is more of like the feeling of physical symptoms.
So yeah, we've actually moved on from the name hypochondria. We'll still kind of use it for this episode because it's easier. Yeah, those are the 2 that have replaced it. Before we continue, you may be wondering why it's no longer in the DSM. And so from Eddie's research, he wrote this one. We found that change was made due to the term being considered stigmatized and had negative connotations. Like, how often do you hear that in the movies or something? Mm-hmm. Something coming out of Hollywood is, oh, you're a hypochondriac. Oh, and it does have somewhat of a negative connotation. So I see that.
When saying it that way, hypochondriac, it's not strengths-based or person-centered language. So, right?
Exactly.
Not what we want. But, so the new terms, somatic symptom disorder and illness anxiety disorder, were meant to be more, quote, neutral to describe people with extensive worries about health. But of course, like anything in life, this change did have some criticism. So some say that hypochondria should be reclassified more as a phobia because it represents a specific fear of illness. Others argue that the DSM-5's effort to clarify the spectrum of health anxiety falls short of explaining the nature of hypochondria, which is a good point. Before I did any research, I told Kevy when I said, like, no, it doesn't impact my daily functioning. And if anything, it's probably not hypochondria. It's probably more of a specific phobia. I was incorrect, and I learned that in my research. And we'll tell you, this is the thing that I wanted to say earlier. What we will be discussing is not really hypochondria. It's more illness, anxiety disorder, and somatic symptom disorder. So plot twist. We said we're doing one thing, we're doing another thing. This is what I wanted to mention earlier. When I was looking up both disorders, I figured illness, anxiety disorder would be in the anxiety disorders category. It is not. It is in a separate category with somatic symptom disorder, which I wrote it down here somewhere. It was in the somatic symptom and related disorders chapter. So it basically has its own chapter. They're related to each other. I thought it would be more in the anxiety section, but they decided not.
Yeah, which brings up a good point that the DSM-5 is largely a guideline. Some people And I think we, even in the past, have referred to it as psychiatry and mental health's Bible. But it is not. It's something that's always changing and moving. There have been mistakes in the DSM-5, and they're made by a committee of humans just trying to do their best. So,
Yeah.
it's not perfect. It's not a perfect document.
Yeah. And depending who you ask, there's going to be people who are like, I fucking hate the DSM. There's going to be people who are like, yeah, it's fine. Like, it's just like they're moving more towards like a spectrum-y design of different disorders. There's a spectrum of people and what their thoughts are. So, looking at somatic symptom disorder. Here's the definition. Here's the criteria. Here's where we differentiate somatic symptom disorder with illness anxiety disorder. So for SSD, a somatic symptom is a physical symptom that causes a person to have excessive thoughts, emotions, and or behaviors related to the symptom. So some of the criterion, one or more somatic symptoms that are distressing or result in significant disruption of daily life. The next is excessive thoughts, feelings, or behaviors related to the symptom as manifested by one of the following. So disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high levels of anxiety about health of symptoms, and then excessive time and energy devoted to the symptom or health concerns. And although any one of the somatic symptoms may not be continuously present, the state of being symptomatic is persistent, which is typically more than 6 months.
There are some specific specifiers that go with the diagnosis as well that can kind of help classify what we're dealing with a little bit more, because somatic symptom is a very broad term. So some of those specifiers are with predominant pain, persistent, this is for severe impairment for more than 6 months, mild, which means that you have one symptom, which criteria B is fulfilled, moderate, 2 or more symptoms, and then severe is the same as moderate with an addition of multiple somatic complaints or one very severe somatic complaint. So, like everything, they try to categorize a mild, moderate, and severe, and there's just a whole number of things you can choose from to make it that way.
It depends.
It depends, yes.
It's such a, in terms of causes of SSD, there was a few things that came up. So one of them was genetic and biological factors, such as an increased sensitivity to pain. There's family influence, which may be genetic or environmental or even both. There's a personality trait of negativity, which can impact how you identify and perceive illness and bodily symptoms. There could be a decreased awareness of or problems processing emotions, causing physical symptoms to become the focus rather than the emotional issues. And then it could be learned behavior. So, for example, the attention or other benefits gained from having an illness or, quote, pain behaviors in response to symptoms, such as excessive avoidance of activity, which can increase your level of disability. I mean, basically, like, if someone maybe consciously or unconsciously sees, like, I get more out of being more sick, I therefore am more sick because I like these benefits or I want these benefits.
Yeah, and to give you an example, I've worked with some kids in the past who may not have the most healthy and nurturing relationship with their mother. Sorry to get a little, Sigmund Freud here, talk about relationship with your mother. But they learn that, when I do get sick, Mom is more nurturing. She pays more attention to me. She takes care of me. She gives me the things I want. She cooks me the food that I want. So some kids learn that they can use that or pretend to be sick to connect with their parents a little bit more. So it is positively reinforced. And then before you know it, they get older and they sometimes don't even realize that they're doing it. Or sometimes their brains are so powerful that they can kind of make themselves sick and believe that they're sick because it's worked for them and gotten them that attention, that love, that nurturing relationship with their mother that they were craving when they were younger.
Yeah. What do we have next?
An interesting note before we get to illness anxiety
that was
disorder.
The part I said earlier. My bad. I should.
Sorry. My bad.
No,
Skip that part. I'll jump into illness anxiety disorder, also referred to as the former of hypochondria and health anxiety, is defined with the following: preoccupation with having or acquiring a serious illness. So that's the difference between somatic symptom disorder and illness anxiety disorder. With somatic symptom, you're actually feeling something in your body. Illness anxiety disorder is that you're just worried about getting a disease in the future, but you're not actually symptomatic.
Yeah. Somatic symptoms, the next criterion is that somatic symptoms are not present, or if present, they're only mild in intensity. So again, this is really more of the anxiousness part as opposed to actually having physical symptoms.
There is a high level of anxiety about health, and the individual is easily alarmed about personal health status.
Mm-hmm. The individual performs excessive levels of health-related behaviors. So that could be things like repeated checks for signs of illness, or they exhibit maladaptive avoidance. So they avoid doctor's appointments.
Illness preoccupation has been present for at least 6 months, but the specific illness that is feared may have changed over time.
Mm-hmm. So they're always anxious about some type of illness. And then the last couple things are that symptoms are not better explained by another diagnosis. I can't remember what examples they gave, but could be maybe more of like, maybe it falls more under like specific phobia, or maybe it falls more under something else, or not better explained by something else. And then it does come with 2 specifiers. So there's the care seeking, like we talked about, or the care avoiding type, in terms of what other additional specifiers can be added.
Mm-hmm. So causes of illness anxiety disorder. Some actually can be around your beliefs. You may have a difficult time tolerating uncertainty over uncomfortable or unusual body sensation. This could lead you to misinterpret that all your body sensations are serious, so you search for evidence to confirm that you have a serious disease. I think I've seen this in the past with like people who sometimes like feel like food gets stuck in their throat.
Oh yeah.
And that's a pretty normal thing, having that sensation of it's not fully going down, and then they jump right to I've got throat cancer, and it's like, okay, well, we don't know that for sure, but they're always so worried about it.
It makes me think of like ARFID, avoiding restrictive food intake disorder. I feel like I heard from patients in the past where like it kind of started from it's kind of related, but having like a choking episode or something going wrong with food where their throat did swell up or they closed up or they were choking on something, and from then it's like, yeah, I'm never fucking eating again, kind of thing. So kind of similar. Another piece that can be a cause of IAD is your family. So you may be more likely to have health anxiety if you've had parents who worry too much about their own health or your health. So if you are getting it a lot and they're worrying you and they're stressing you out, you learn what you see.
So if you have like an overprotective helicopter mom who's constantly asking you like, are you eating enough? Do you feel okay? Sometimes that sinks in and you start to tune into the things that don't need to be tuned into. Yeah. And then past experiences can also make a big difference. And we've touched a little bit on this, but you may have had a past experience with serious illness in childhood. So physical sensations may be frightening to you because in the past, physical sensations led to being sick. It doesn't always mean that they're going to lead to being sick, but you're afraid that they may.
Mm-hmm. That makes me think, I had a classmate in like elementary school who got mono and was gone for like 6 months. That would stress me the fuck out if I came back to school. Like, I'm not going back, man.
Never again.
I don't know.
Yeah, that's a long time to miss for an illness.
That's like the whole year almost.
Yeah, that's ridiculous. Now, some quick stats and facts for you guys. Illness anxiety disorder, formerly known as hypochondria, is extremely rare. It affects only about 0.1% of people in the United States, and it typically appears during adulthood.
Mm-hmm. Some possible treatment options for illness anxiety disorder include anti-anxiety medications and talk therapy like CBT to be able to talk through the concerns and find ways to cope. With this in mind, as a therapist, that made me think, well, things like ACT and DBT can probably be helpful too. Just depends on what works best for you in your way of finding how to cope and how to deal with stressors and how to manage what's going on.
Mm-hmm. And I actually spoke with an attending once who had a whole clinic that was CBT for people with somatic symptom and chronic pain. And I think we need a lot more of that stuff, especially in the wake of the opioid epidemic, because
Yeah.
a lot of people do have a lot of chronic pain, and there are some really evidence-based and proven ways to deal with it and change it that can be pretty effective.
Yeah. Oh man. It makes me think of another person. When I worked at a different job, there was a resident who, I think they like won the lottery. Not like a huge amount, but like a decent amount. Where like, damn, we got cash, and they had like a boat and a house and all this stuff. Well, they're on the boat one day, and something happened where their arm got smashed like very badly, and obviously they're in a lot of pain. Had to go through surgeries and all that. Well, they started taking opioids, and they started getting addicted to them. And because of that, one day it led to them ultimately getting found with a ton of pills for distribution and buying all that stuff. Ended up in prison, did that whole thing. And as I was talking to them and they were getting ready to get out, I basically just asked, like, what's your plan when you get out? And he's like, oh, I'm going to smoke a fuck ton of weed. Like, I'm so excited for that. That's going to be way better than these fucking pills.
Yeah, at least there's no worry about overdosing on weed like there is on the pills, which is I would say the biggest concern.
Yeah.
So in contrast with illness, anxiety disorder, somatic symptom disorder is a little bit more common and usually occurs in about 5 to 7% of the adult population. So actually quite a bit of people.
Yeah. Similar to IAD, talk therapy like CBT has been recommended along with medication. Again, I would think something like ACT and DBT are probably helpful too.
Yeah, exactly. And we looked up a couple of famous people who have been labeled as hypochondriacs in the past. I tried to fact check this a little bit and make sure that these people were like actually diagnosed in the past.
Yeah.
Howard Hughes. Did you ever see the movie The Aviator with Leo DiCaprio? He was like a filmmaker, I think in the 40s or 50s. I should have done a little bit more research apparently. But he was like a famous hypochondriac and like was always afraid that he was sick, would have had a hard time coming out of his house. It impacted his life. And they show a lot of that in the movie The Aviator too. And then this next one, I don't know, Eddie, have you heard of this guy? Adolf Hitler?
I've heard things.
Yeah. So apparently Hitler was a bit of a hypochondriac as well. And I dove into this one and looked it up. And yeah, he was constantly surrounded by doctors. And he was constantly plagued with all these different vague symptoms and complaining. And that's one of the reasons why Hitler was doing a lot of drugs. Like he was doing a lot of amphetamines. He was doing a lot of uppers. He was doing a lot of pain medicines. And so that was largely because he was constantly complaining of all these somatic symptoms. So I thought that was kind of an interesting one, and one that really impacts history too.
Yeah. Here's with the last one.
Yes. And then Florence Nightingale. Surprisingly enough, someone in the medical field. So she's kind of known as the godmother of nursing. She was the one that really noticed that like surgeons who didn't wash their hands in between cases were spreading a lot of diseases amongst their patients. So like a really bright woman came up with like a lot of the standards and ideals for nurses these days, but even she struggled with a little bit of hypochondria and was, and I think it's more common in people in the healthcare field because you understand all the things that can go wrong.
Yeah, you see all the shit.
Eddie, you think all this stuff, hypochondria, illness, anxiety, somatic symptom, you think it went up over COVID?
Probably. I was trying to find like some actual numbers, but I think at least maybe not like full on diagnosable or diagnosed cases of it, but I think if I just think for me, for example, as a regular person, average person, I don't know, man, when COVID was first started, I was like, I said it early, but seriously, every day I'd be in my office just like taking deep breaths, like trying to make sure I was okay, or like you cough one time, you're like, fuck, that's it, I'm done, I'm dead, I'm not making it. So yeah, I think for sure, I think definitely I think the piece, or one thing I want to mention is that the anxiety, the illness, anxiety disorder, the one that I'm really thinking of specifically, because I know people are still concerned about, rightfully so, concerned about catching COVID or any other kind of contractable airborne disease, is that they are worried about getting sick and then having a really negative experience with it and like getting really like severely sick. Like that makes total sense. So I think there's people who I saw something on Twitter the other day where like someone took a picture of somebody in an airport that still had a mask on and like gloves, and they're like, "Oh, I feel so sorry for this person living like a scared life." And it's like, no, dude, like people are anxious, and people were probably already anxious about things before COVID, and then it happened, and then it's like even worse. Or for other people's experience, maybe they weren't as worried, and then they got sick during COVID, and then it brought up a whole bunch of other symptoms, whether it's long COVID or whatever it is, and it's like, oh shit, I need to be way more careful about this. So all that to say, like, probably I'm sure the rates have gone up. It probably is more common, and it makes total sense given what's gone on the last 4 years. It makes sense.
Yeah, just the fact that depression's going up, anxiety's going up, a lot of these types of things are increasing. So you'd expect, we don't have the hard numbers yet because it takes a while for a lot of this stuff to roll in. But yeah, you'd assume.
Yeah.
Have you ever struggled with being anxious about symptoms? What has helped you?
I think for me, really, it's been like, I can't just keep it to myself. I have to say if I'm worried about something. And I feel like there's been time, because a lot of the time when these somatic symptoms happen, I am probably stressed about something, and that is why it's happening. So by talking about it, I then am mentioning and acknowledging that I am stressed about something. And just by acknowledging it, oftentimes I feel better. So
Yeah.
yes, that's been the most helpful. What about you?
I like to use the CBT strategy of examine the evidence.
Yeah.
And like, am I catastrophizing? Am I jumping to the worst possible conclusion?
Yeah.
Or am I catastrophizing? But like, do I have any other symptoms? Do I have any other reason to believe that I have a brain tumor, that I have COVID? Because it seems like every time, like, I'm a little bit tired and maybe like a little hint of a sore throat, which happens all the time, like living in Colorado because the air is really dry.
Yeah.
I'm like, gotta be COVID. Yeah, I got COVID right now. But it's like, I gotta tell myself I probably don't. Don't.
Yeah. I talked about it a little bit, and I'm interested to hear what you think, but do you think illness, anxiety disorder, or IAD, is categorized correctly in the DSM-5?
There's always something that could be made better. I like the improvement going from hypochondria because it's always such a tricky argument. Like, there are so many words that are stigmatized that are technically, like, in and of themselves totally fine. Like the fact that we've changed the word for people who have developmental delays so many times because of the stigma around it. Like, they used to be called things like morons and imbeciles, and then people started to use those as insults, and then retarded used to be a totally normal word, a medical word, and then that got stigmatized because people used it as an insult. Now kids are calling each other DD for developmental delays. Like, so maybe we need to learn just to not stigmatize things, because hypochondria is actually like a decent word for it. But yeah, I think it was time, because if you labeled or brought up the possibility of hypochondria with anyone who actually does have hypochondria, it's immediate, I'm not a hypochondriac, so it could lead to some defensiveness. So I can see why the change was made. And I do like the splitting it into somatic symptom and illness anxiety disorder. So yeah, I like it overall. Yeah. How about you?
I was just bothered by the fact that I went to the anxiety disorder chapter fully thinking like, oh yeah, I know what I'm doing. I've been around the block a couple times and couldn't find it. I was like, what the fuck? So then I had to go back. And the other part is my copy is electronic, so that makes it a little more annoying because there's a ton of pages. So I scroll through the whole PDF and then I have to go back. It was just, I was more annoyed than anything.
You didn't just Control F and find and like type in hypochondria and
fuck, can I do that? On a PDF, can you do that?
Oh yeah, that's a real thing, man.
Stop. Hold on. I'm doing it right now. Hold on.
Okay.
Hold
I'm hoping.
on.
I'm not 100% sure, but I've done it on a PDF.
Now we're backtracking. Okay. Hold on.
Hedging my bets a little bit.
Okay, Control F. Nope, didn't work.
Didn't work?
No, is it? It's a Mac. Do I have to do something different? Command
Oh, it might
F?
be something different.
Oh,
It was
totally
Control
is
F.
command. Yep.
Okay, well, let me Google it now. We got to know.
No, you're right. Yep.
You could search the whole time?
Yep, 100%. That's hella funny.
See, Useful life tips from MMHC. You're welcome. You're welcome.
Well, that brings us to the end. Enjoy, everyone. Well, in seriousness, we hope you liked our little deep dive on hypochondria or hypochondriacs. Hopefully we gave you some new knowledge, because I know I learned a lot just from typing up the notes. And I'm going to go ahead and wrap us up. Thank you all for listening. Shout out to my students that I just taught this summer. Every year, I don't tell anybody that I have a podcast. In the last day of class, I let them know. So if any of them decided to listen and made it to the end, welcome. Appreciate you being here. Shout out to you guys. Happy end of summer term. Thank you to the rest of you for listening. You know where to find us on Apple Podcasts, Spotify, wherever else you get your podcast. Feel free to leave us a 5-star review. You can follow, listen, subscribe, all those good things to help continue to get the channel out there. I think we're in the top 150 in like Peru or something currently, so that's pretty cool. Keep listening, keep sharing, keep subscribing on social media at Millennial MHC. That's Twitter, Instagram, TikTok, and YouTube, and at our website millennialmhc.com. Thank you all. We hope you enjoyed. I had a good time. I know you did too, Justin.
Yeah.
And remember, take care of y'all mentals.